The Health Minister, Dr. Zweli Mkhize, has confirmed that the country will resume the Johnson & Johnson vaccination drive on Wednesday. Governments halted the rollout following reports of 6 women developing unusual blood clots after receiving the vaccine in the United States. Mkhize said there is information of possible side effects, but assured South Africans that the risks are very minimal. The minister also said that the country will receive over 1 million Johnson & Johnson doses soon.
This is good news for us because we have had a halt, which was a temporary issue. And of course, we've come out now with a date that we're going to resume on the Wednesday. What is new is that we will be sending in additional information about possible other side effects that people must be alerted to. And in this case, we will then make sure that all those who come in for the remainder of the vaccination redo their consent, and they've got now new information that suggests that there is this risk, although it's very, very low at 1 person per 1 in a million kind of incidence. Now, it's important for us because we've got, any time now, we'll be receiving 1.1 million vaccines from Johnson & Johnson. As we are all aware, they are manufactured, they're waiting for the final audit so that they can be released. So anytime now, we expect them to be with us because they are just here in Gqeberha in Port Elizabeth. So that means now we'll be able to move on. But in the process of moving on, we'll be informing people that certain symptoms that they must keep a lookout for. And if they do find those symptoms, they must get checked so that we can just be sure that it's not a problem.
For more on the resumption of the trial, I'm joined now by Professor Glenda Gray, the co-principal investigator of the Sisonke implementation study. Good to have you with us this afternoon, Prof. When we listened to the minister there, he spoke about some symptoms that one could possibly experience, which would be a sign to a possible blood clotting. Perhaps can we start with that? Could you outline what those particular symptoms would be?
Sure. So about 4 days after the vaccination, up until about 3 weeks, so between 4 days and 28 days, this usually occurs in women aged 18 to 48, so it's mostly been described in women. It's an unrelenting headache. So if you have a vaccine and 4 days later you have an unrelenting headache that won't go away, and you could have vomiting as well, or if you presented with severe abdominal pain that doesn't want to go away, or leg pain, it's important to call your doctor or the Sisonke desk or our safety team. So it's those are signs of this rare clot that we were talking about, this rare clotting disorder, and it's quite the signs and symptoms are quite specific. Severe abdominal pain, severe headache, or pain in your legs. It's important for you then to contact your doctor or the vaccination center or our safety desk.
And should those symptoms start manifesting themselves in a particular individual's body and they do report this and they go to their doctor, what measures will the medics then be putting in place? Is there something that they can actually do for you? We have had individuals in the United States actually dying from this.
So yes, so what we will do is we'll do your clotting factors, and we'll look at your platelet count. And so this VIT, vaccine-induced thrombocytopenia and thrombosis, is associated with what we call low platelets. These are little cells in your body that help you clot, and it's associated with low platelet counts. And if you have this, it's important for us to then admit you to the hospital and to manage you in a certain way. Normally, people who have got thrombosis or clots usually get heparin, and in this case, we do not give you heparin. And so all of the cases that have been managed well have not been fatal, and we've only had one case that's been fatal, and this person was not diagnosed in the right time. And so we are confident that if you are aware of your symptoms and you are feeling anxious, is to talk to us, is to call your service provider and work with us and our hematologists to make sure that we can manage you properly. Our hematologists have assured us that if detected, these are manageable and easy to treat, but we have to detect them and manage them together with with doctors who are looking after participants who receive this. So it's very important. We are augmenting safety, we may be overcautious, but I think we believe that safety is important. And even though we may be overcautious, it's better to be overcautious and prevent anything from happening rather than not being cautious at all.
Could you give us details, Professor, of the no-fault compensation fund that is going to be established, and what circumstances would lead to one being able to claim from that fund?
So these no-fault compensations or indemnification by governments have occurred at a global level, and every country that gets vaccines, either from COVAX or from the manufacturer themselves directly, have had to enter into these no-fault compensation programs with the manufacturers. And this is a relationship between the government and the manufacturers that work together to mitigate risk if anything should happen. And so the risk is shared, and the government together with the manufacturer will develop a no-fault compensation that makes sure that the risks of manufacturing and the risks of vaccine deployment are shared and are borne largely by the governments who need and require these vaccines.
So for South Africa, when will this compensation fund actually kick in?
Well, I think there's an interim process at the moment that bridges the gap. On Monday, I think it was the last time the public could comment on this no-fault compensation. By law, the public have to comment on it, and the government has to take into consideration what the public says. And in the interim period, the Disaster Management Act does allow for a bridging process that we don't have to wait to be able to roll out vaccines. If we had to wait until the no-fault compensation was officially constructed, we would lose time. And so in the interim period, there is a bridging process that allows the country to move forward and deliver the vaccines.
The suspension of the rollout program was really to investigate if there are any causal links between COVID-19, or rather between blood clots and the Johnson & Johnson vaccine. If you could summarize for us exactly what was found during this suspension period and how that has implicated how the rollout is now going to unfold.
So this allowed us time to look at both the local data and the international data on safety, and allowed us to review all our data on clotting and to review the international data and to go back to all the studies to see whether there were any unusual thromboembolic events. It also allowed us to articulate and define what we were looking for, this vaccine-induced thrombocytosis and thrombocytopenia, and allow us to develop an algorithm to identify and manage it. So this whole process allowed us to augment the way we would define and manage it, and the way we could train our healthcare workers, our investigators, and the way we could improve the safety monitoring. So what we have done is any safety event will be reported to the regulator within 24 hours. We will meet regularly to review any safety and to make sure that we're picking up all the events that we expect to pick up. So it was a time just to look and get all our ducks in a row to make sure that when we execute the continued rollout, we are in a strong position to identify should any risk arise. At this moment in time, we have not seen any rare clotting disorder that's associated with this syndrome, but there again, we've only vaccinated up to 290,000 individuals, and it is possible that we will begin to see it. The minister, as he mentioned, this occurs in 1 million cases of people being vaccinated, and so although this is a rare event, we want to make sure we pick it up and prevent anything adverse relating to the clot happening in the future. So we don't want any fatalities. We want to be able to manage these clotting events in South Africa in an adequate and optimal way.
The minister has mentioned that those who are pregnant and lactating should not be administered with the vaccine. Give us reasons around that and why.
Well, I think they're concerned about, at this stage, given the clotting, they were concerned that in the postpartum period there may be some events that we may not be sure of. And so I think the regulators want to be sure that this vaccine is safe in breastfeeding women and in pregnant women. At the moment, women have breastfed, both in the Sisonke study and in previous studies, Ensemble 1, the first regional study, and there's also a trial in pregnant women that's ongoing. So once the regulators have had time to review all the safety data from these studies, they will be able to make a call on whether breastfeeding should occur or whether a pregnant woman should be enrolled. And so what we are doing is bringing the data to the regulators so that they can make a decision on this.
I understand that those who had registered before the suspension need to re-register for the continuation of the vaccination rollout study. Why is this the case?
Because we want to make sure people understand the new information. And so people might have registered a long time ago. The informed consent that they agreed to, they may have forgotten what they agreed to. And so we want people to go through the informed consent process again. We want them to look at the specific bleeding and clotting issues to make sure that if they have any history of allergies or anything like that they alert us. So we want to vaccinate in a way that protects people's safety. And we can do this if we have full knowledge. And we also want the healthcare workers to declare the issues that they may have with clotting so that we can work with them. We know that people with clots and with clotting disorders are more at risk of getting COVID and have more at risk of getting bad side effects from having COVID. And so it's very important for us to make sure we protect these people. But we can only protect people if we know what their ailments are, and we can work with them to make sure that they have an uneventful vaccination process.
There is also the issue, Professor, of lost time. Are you going to try and cover that up so you can keep, or at least try and keep as much to the deadlines which have been missed?
Yes, our team are rearing to go, so everybody is waiting to start again. We've been retraining the teams. We're waiting for all our ethics approvals to come into place, and we hope to have all systems go on Wednesday. The teams are desperate to get back into the field and finish the job that they've signed up for, and that is to deliver a further 200,000 doses to healthcare workers in South Africa.
Professor, thank you very much for your time and your update this afternoon. That's Professor Glenda Gray there on the Johnson & Johnson Sisonke vaccination program, which will once again kick off after being suspended for further studies on Wednesday.